Hello everyone, welcome back to another lesson. In today's video, we are going to talk about the chest x-ray. This is going to be the basics regarding what a chest x-ray is, why it is ordered, and we are going to talk about the anatomy relating to the chest. So why is a chest x-ray ordered? Just to name a few, it is for chest pain, shortness of breath or SOB, persistent cough, fever, pneumonia, emphysema, lung cancer, pneumothorax or collapsed lung, and COPD. And when I work in x-ray, we have something called a PA chest, and this is like the standard frontal chest x-ray view that we normally take for patients. It is used to visualize the lungs, heart, and other chest structures. The x-ray passes through the patient's back, which is the posterior, to the front anterior. So that's why it's called the posterior anterior view. Now we have our lateral chest x-ray. The lateral chest x-ray is commonly performed as well, especially if a doctor ordered a two-view chest and the patient's left side is against the x-ray detector or our x-ray board. A side view of the chest is taken. This is great at visualizing structures that are obscured on a standard frontal PA view, and then it can visualize the heart, great vessels, trachea, bronchi, and lower lobes of the lung. Now we are going to talk about our clavicle bones. This connects the sternum breastbone to the scapula or shoulder blade. And here you see how the clavicle bone looks. You see the arrow pointing to the clavicle bone. And this is like a more breakdown of the anatomy of the clavicle. Now we have our ribs. We have 12 ribs on each side. Rib 1 through 7 is considered the true ribs. And then you have your false ribs is ribs 8 through 12. Your floating ribs is ribs 11 through 12. Now we are going to talk about the heart. The heart is a muscle and is very important. It's a very important organ that pumps blood throughout the body. It delivers oxygen and nutrients to the cells and remove waste products. And typically it's located on the left side of our chest. That's why you see the red arrow pointing to the heart, which is on the left side in this picture. However, sometimes it may be found on the right side, which is called dextrocardia. It's also slightly left of the breastbone, and the heart has four chambers, two right atriums and two left ventricles. And as a radiologic technologist, it's very important for us to place these markers. These are our anatomy markers. L stands for left, R stands for right, and then you see those initials at the bottom of the technologist who is performing that x-ray. So it's important for us to have our lead markers because it determines which side of the body that the patient is. So say for example, if the heart is normally located on the left, then we will put our left marker on the left side of the body so that the radiologist can know this part right here is the patient's left side or this part right here is the patient's right side. It's very important because if a patient is diagnosed with dextrocardia, the doctor know how to treat it versus the image was just flipped or the tech accidentally marked the wrong side. Now we have our lungs. At the very top, you have your apices, and then you have your lungs being located in the chest cavity, located within the rib cage. It is found on either side of the heart, known as the thorax as well. The lungs is it takes oxygen from the air and release carbon dioxide. We have two lungs. It's a big part of the respiratory system to allow for breathing. And like I was saying, the APCs are found at the very top of the lungs. I would never forget that part of the lungs anatomy because when I was an x-ray tech student, I actually got points taken off because I wasn't familiar with the APC. So I can never forget where the apices is located at. And instead of me having points taken off, I think I actually received like a 50 on that competency exam. So as an X-ray student, we have different competency forms, and we just check off what we're competent in. And one of the first X-rays that I was taking, I did well on the X-ray as a student, but you have to know your anatomy as well to make sure that you aren't clipping anything. Now we have our diaphragm. This is a large dome-shaped muscle. It's located at the base or the base of the chest cavity, separating it from the abdominal cavity. Its role is for breathing by contracting and relaxing, allows for inhaling and exhaling. Then you can see this image right here where it's highlighting the diaphragm in red. And then now we're going to talk about our costophrenic angle. This is a sharp angle at the level of the diaphragm and the rib cage on a chest x-ray. Normal angles appear sharp and blunt, and this is an important landmark for pleural fluid or thickening. Now we have our corona. This is the ridge located where the trachea or windpipe divides into right and left main bronchi, which lead into the lungs. So above the arrow, you will see that that's where your trachea is located at. So just keep that in mind. You can also see on this animation, the trachea is right above where that red circle is, that long tubing. Let me see if I can point to it. Is your trachea. So give me a moment, which can be found like right here. And it is considered the end of the trachea. That's what the corona is. Considered the end of the trachea and beginning of the two main airways of the lungs. Now we're going to talk about the aorta arc, which is the largest artery in the body, located between the ascending aorta and the descending aorta. It distributes blood to the head, neck, and arms. That's it for this quick lesson. Please give the video a thumbs up or leave a comment if you would like me to have or make more anatomy review videos. For X-ray, I do work in radiology as a radiologic technologist working in multiple areas in radiology, and it's very important for us to know our anatomy, those positioning standards that you've seen. That's how most of our patients are positioned, especially if they're able to walk or stand. We also do have to deviate a little bit if a patient has to sit down, so we have to angle the x-ray tube a certain way. But overall, this is just a basic introduction to what a chest x-ray is. And also feel free to hit the subscribe button for more videos. Thank you all for watching. Bye.